My name is Dr. Brian O'Connor, and I am a board-certified obstetrician-gynecologist and addiction medicine physician. My journey was a difficult one. I was trained as an OBGYN, but in 2004, I found out that my son was addicted to heroin. I was unsure what to do, but I knew that I needed help somehow. Unfortunately for me, my knowledge base in addiction was not where it should be, so I went back and I trained in addiction medicine. Middlesex Recovery is a practice in addiction medicine that I started in 2010 to provide care for the community. It involves both medication and counseling, but also a place patients can go that they know that the staff understands their problems and their issues and is well geared to provide services for them. There's genetic and biological factors that go into who develops a substance use disorder. It is not a personality flaw. It is a medical condition that has a biologic basis and treatment. Opioids and alcohol are addictive because they work at the pleasure center of our brain. And the pleasure center is designed to have us repeat activities. So these substances work in our brain to stimulate the pleasure center and therefore causes us to repeat that activity over and over again. What makes fentanyl so powerful is that it has three qualities that allow it to be abused in the community. It's potent, it's inexpensive, it's plentiful. So what's happening on the street is that it's actually being mixed with other compounds, but they don't tell anybody. So you think you're buying cocaine, but the cocaine has been laced with fentanyl. In order to treat somebody with a substance use disorder, you need specialized training. This specialized training involves an understanding of addiction, its side effects, the psychosocial ramifications of addiction, as well as specialized training in order to provide certain medications. For many patients, the decision to enter treatment is one of the more difficult decisions that they'll make. When that decision is made and they present to Middlesex Recovery, they will be met with compassion and understanding. During consultation with your provider, be it a physician, a nurse practitioner, or a physician assistant, the history will be reviewed, questions will be answered, and together a plan will be made for your recovery. That will include counseling, group therapy, as well as medication-assisted treatment, to include Suboxone and Vivitrol. It's important to understand that recovery is possible. It's not always a straight line, it's not always easy, and it takes a team of people to do it. That team includes the patient, obviously, the provider, counseling, and a supportive environment that Middlesex Recovery provides. We have 6 locations. In Massachusetts, we are located in Chelmsford, Woburn, Gloucester, Stoughton, and Norton, as well as Salem, New Hampshire. Visit middlesexrecovery.com for more information about services and treatment locations.